Welcome to this educational video on Scheibe dysplasia, also known as cochleosaccular dysplasia. This condition primarily affects the inner ear and leads to hearing loss. In this video, we will explore the causes, mechanisms, symptoms, diagnosis, treatment, and current research surrounding this complex disorder. The etiology of Scheibe dysplasia is primarily genetic. It's most often linked to mutations in genes responsible for the development and function of the inner ear. While the exact genes implicated can vary, mutations affecting the stria vascularis and other structures essential for sound processing are frequently observed. Both autosomal dominant and recessive inheritance patterns have been documented, implying that a single copy of a mutated gene from one parent can cause the condition in some cases, while in others, both parents must carry the gene for their child to be affected. Environmental factors are not currently believed to play a significant role in the development of Scheibe dysplasia. Let's delve into the pathophysiology of Scheibe dysplasia. The primary area affected is the membranous labyrinth of the inner ear, specifically the cochlea and saccule. The cochlea, crucial for converting sound vibrations into electrical signals for the brain, exhibits a characteristic collapse of the Reissner's membrane and degeneration of the organ of Corti, the sensory epithelium within the cochlea. The stria vascularis, responsible for maintaining the ionic balance within the cochlear fluids, also undergoes atrophy. The saccule, part of the vestibular system responsible for balance, is similarly affected. These structural abnormalities disrupt the normal transmission of sound and processing of balance information, resulting in sensorineural hearing loss and potential balance problems. Data on the precise epidemiology of Scheibe dysplasia is limited, as it is often grouped under the broader umbrella of congenital sensorineural hearing loss. It is considered a relatively rare condition. Its prevalence varies depending on the population studied and the diagnostic criteria used. Due to the genetic nature of the disease, it's observed across different ethnicities and geographical locations. However, regions with higher rates of consanguineous marriages may see a slightly increased incidence of recessive forms of the condition. The hallmark sign of Scheibe dysplasia is sensorineural hearing loss, which is usually progressive, starting from early childhood and sometimes even present at birth. The severity of hearing loss can vary, ranging from mild to profound. While hearing loss is the predominant symptom, some individuals may also experience balance problems or vestibular dysfunction. Although this is less common, these balance issues can manifest as dizziness, vertigo, or difficulty with coordination. Diagnosing Scheibe dysplasia involves a combination of audiological testing and imaging studies. Audiological evaluations, such as pure tone audiometry and tympanometry, are used to assess the type and degree of hearing loss. An auditory brainstem response (ABR) test is particularly helpful in identifying hearing loss in infants and young children. High-resolution temporal bone computed tomographies, as CT or magnetic resonance imaging (MRI), can reveal structural abnormalities within the inner ear, such as the characteristic cochleosaccular dysplasia. Genetic testing can also be performed to identify specific gene mutations associated with the condition, which can aid in confirming the diagnosis and providing information for family counseling. Scheibe dysplasia is not typically classified into different types, but rather described by the degree of severity and the specific genetic mutation involved. The severity of hearing loss is graded according to standard audiological classifications: mild, moderate, severe, and profound. Genetically, different mutations can lead to varying degrees of inner ear malformation, contributing to the heterogeneity of clinical presentation. Describing the specific gene mutation provides a more precise characterization of the condition. Currently, there is no cure for Scheibe dysplasia. Treatment focuses on managing the hearing loss and optimizing communication abilities. Hearing aids are often the first line of intervention to amplify sounds and improve auditory perception. For individuals with severe to profound hearing loss, cochlear implantation may be considered. Cochlear implants bypass the damaged portions of the inner ear and directly stimulate the auditory nerve. Vestibular rehabilitation therapy can be beneficial for individuals experiencing balance problems. Speech therapy and auditory training are also important components of management to improve speech and language development. Since Scheibe dysplasia is primarily a genetic condition, there is no known way to prevent its occurrence. However, genetic counseling is crucial for families with a history of hearing loss or known mutations associated with Scheibe dysplasia. Genetic counseling can provide information about the inheritance patterns, the risk of recurrence, and available options for prenatal testing or preimplantation genetic diagnosis. The prognosis for individuals with Scheibe dysplasia varies depending on the severity of hearing loss and the effectiveness of management strategies. With appropriate intervention, such as hearing aids or cochlear implants, many individuals can achieve significant improvements in their communication abilities and overall quality of life. Ongoing research is focused on identifying new genes involved in inner ear development and exploring potential therapies, such as gene therapy, to restore hearing function. Advances in cochlear implant technology are also continually improving the outcomes for individuals with severe hearing loss due to Scheibe Dysplasia. This offers hope for future therapeutic interventions that may be able to address the underlying causes of the condition.